Maintaining a healthy balance in the body's natural blood clotting process is essential for overall health. Clotting is an important mechanism that helps prevent excessive bleeding when you are injured, but when unnecessary blood clots form, they can cause serious health risks such as deep vein thrombosis, stroke, or heart attack. Fortunately, there are natural ways to help control the risk of clotting, supporting the body's innate ability to maintain a safe balance. Understanding the factors that affect clot formation and making reasonable lifestyle choices can play a crucial role in your long-term health. First, it is important to recognize what a blood clot is and why they form. A blood clot, also called a thrombus, is a mass of blood that changes from a liquid state to a gel or semi-solid form. This process is triggered by platelets and proteins in the plasma working together to stop bleeding. Under normal circumstances, this is a protective reaction. However, certain factors, such as a sedentary lifestyle, poor diet, dehydration, or underlying medical conditions, can increase the risk of forming dangerous blood clots even without injury. One of the most effective natural ways to control the risk of blood clot formation is to maintain physical activity. Exercise helps promote healthy blood circulation, preventing blood from pooling and thickening in the veins, especially in the legs. Simple activities like walking, stretching, or light cycling can make a significant difference. If you have a sedentary job or lifestyle, try to stand up and move around once every hour. Even small movements like ankle rotations or toe wiggles can stimulate circulation. For those who frequently travel, especially on long flights, the habit of standing up and walking periodically in the aisle is very beneficial. Providing adequate hydration is another important factor in reducing the risk of blood clot formation. When your body is dehydrated, the blood becomes concentrated and thicker, increasing the likelihood of clot formation. Try to drink water regularly throughout the day, especially in hot weather after exercising or when you are sick. Herbal teas and water-rich foods such as cucumbers, watermelon, and berries can also contribute to your daily water intake. Diet plays an important role in supporting vascular health and controlling the risk of blood clot formation. Focus on incorporating foods with natural anti-inflammatory properties and that support blood circulation. Omega-3 fatty acids found in fatty fish such as salmon, mackerel, sardines, and plant sources like flax seeds and chia seeds are known for their ability to reduce inflammation and decrease platelet aggregation, a process that can lead to blood clot formation. Nuts, avocados, and olive oil are also excellent sources of healthy fats that support heart health. Fruits and vegetables rich in antioxidants, such as berries, oranges, leafy greens, and tomatoes, help protect blood vessels from damage and reduce the risk of abnormal blood clotting. Garlic, ginger, and turmeric are particularly notable for their blood-thinning abilities. For example, garlic contains a compound called allicin, which can help prevent platelets from sticking together. Ginger and turmeric contain natural anti-inflammatory substances that can support healthy blood circulation. Regularly adding these spices to meals is a tasty way to enhance the body's natural defenses. It is also important to pay attention to types of foods that can increase the risk of blood clotting. A diet high in saturated fats, trans fats, and added sugars can contribute to inflammation and artery damage, creating a favorable environment for blood clots to develop. It is advisable to limit the consumption of processed foods, fried foods, and sugary drinks. Instead, prioritize whole, minimally processed foods to nourish the body and support healthy circulation. Maintaining a healthy weight is another important factor in controlling the risk of blood clot formation. Excess body fat, especially around the abdominal area, can increase pressure on the veins and promote inflammation throughout the body. Losing even a small amount of weight, if you are overweight, can provide significant benefits for the cardiovascular system, reduce pressure on the veins and arteries, and lower the risk of blood clot formation. Stress management is sometimes overlooked, but it plays an important role in overall vascular health. Chronic stress leads to the release of hormones such as cortisol and adrenaline, which can constrict blood vessels and promote blood clot formation. Mindfulness methods like meditation, deep breathing exercises, yoga, or Tai Chi can help reduce stress and its negative effects on the circulatory system. Even just spending a few minutes each day in nature, listening to gentle music, or practicing gratitude can make a significant difference. Sleep is another pillar in natural blood clot prevention. Poor or insufficient sleep can disrupt the body's hormonal balance and increase inflammation, both of which can contribute to a higher risk of blood clots. Try to get 7 to 9 hours of quality sleep each night. Establish a relaxing bedtime routine. Keep the sleeping environment dark and cool, and avoid screen use before bed to promote deep and restorative sleep. If you smoke, quitting is one of the most important steps you can take to protect your vascular health. Smoking damages the lining of blood vessels, increases inflammation, and makes platelets more likely to clump together, all of which increase the risk of dangerous blood clots. Even exposure to secondhand smoke can cause similar effects. Seek support from healthcare professionals, support groups, or cessation programs if needed. Your cardiovascular system will thank you. Alcohol consumption should also be moderate. Although there is some evidence that light to moderate drinking, especially red wine, may have protective effects due to antioxidants like resveratrol, drinking too much alcohol is harmful. Heavy alcohol use can increase blood pressure, damage blood vessels, and raise the risk of blood clots. If you choose to drink alcohol, do so in moderation. Generally, this means up to 1 drink per day for women and 2 drinks per day for men. Some natural supplements and herbs have been studied for their potential to support healthy blood clotting. For example, nattokinase, an enzyme extracted from the Japanese food natto, has been shown to help break down fibrin, a protein involved in blood clot formation. Ginkgo biloba and grapeseed extract are other supplements that may help support circulation and prevent excessive clotting. However, it is important to consult a healthcare professional before starting any new supplements, especially if you are taking prescription medications, as some natural remedies can interact with blood thinners or other drugs. Regular health monitoring can be an effective tool in managing your risk of blood clot formation. Some people have underlying conditions such as atrial fibrillation, diabetes, or inherited clotting disorders, which significantly increase their risk. If you belong to a higher risk group, regular health checkups and blood tests can help you and your doctor detect potential problems early and take proactive measures to address them. If you notice symptoms such as unexplained swelling, pain, redness, or warmth in a limb, sudden shortness of breath, chest pain, or changes in vision, seek medical attention immediately. These could be signs of a blood clot. Hormonal changes can also affect the risk of blood clot formation, especially in women. Birth control pills, hormone replacement therapy, or pregnancy all increase the likelihood of blood clot formation due to changes in estrogen levels. If you are considering using hormone medications or are pregnant, discuss your individual risk factors with your healthcare provider. Together, you can develop a plan to minimize risks while still supporting your overall health. Understanding your family history is another important step. If you have close relatives who have had blood clots or bleeding disorders, you may have a genetic predisposition. Sharing this information with your healthcare provider can help them tailor recommendations and appropriate screenings specifically for you. Learning to recognize and avoid certain risk factors in daily life can help you better protect yourself. Prolonged immobility, such as after surgery, during long car trips, or bed rest, can significantly increase the risk of blood clot formation. If you anticipate a period of limited movement, take compensatory measures. Wear compression stockings, regularly move your legs, and stay well hydrated. In some cases, doctors may recommend additional preventive measures. It is also important to inform about medications that may affect the blood clotting process. Some prescription drugs, such as hormone therapy, certain cancer treatments, and even some antidepressants, can alter your body's blood clotting mechanisms. Always discuss the risks and benefits of any medication with your healthcare provider, and inform them if you notice any symptoms of blood clotting. Finally, remember that natural methods to control the risk of blood clots work most effectively when combined in a comprehensive approach. It's not just about changing one thing, but about combining many healthy habits: daily exercise, balanced nutrition, staying hydrated, reducing stress, quality sleep, and regular health checkups. Each step supports the others, creating a solid foundation for lifelong vascular health. By proactively supporting the body's natural balance, you can significantly reduce the risk of dangerous blood clots forming. Small, consistent actions, such as drinking more water, adding more leafy greens and omega-3s to your diet, walking daily, and managing stress, will accumulate over time. Your circulatory system is resilient and responsive, and with careful care, you can help it function at its best for many years to come. Always consult a doctor before making major changes, especially if you have underlying conditions or are taking medication. With awareness, dedication, and the power of natural choices, you can protect your health and enjoy a dynamic, vibrant life.